These are the current COVID treatments. So these are just medications to treat the symptoms of COVID, and they're different from the vaccines. We'll look at the vaccines in the next chapter. But this was remdesivir. This was given to President Trump and was something that allowed for him to recover pretty quickly, in addition to any other patients that are given remdesivir. So it is an antiviral drug. There are very few antiviral drugs. Most drugs you've heard of that can fight diseases are antibiotics. So this is an antiviral, and here's the structure of it. Now I know it's a complicated structure, but let's see if we can find some functional groups. So you can see this benzene ring is here. This is the carbon double bond oxygen single bond, that's ester. And then anytime you have a nitrogen, like here, 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 that's an amine group. When you have an oxygen, it's got carbons on either side, like here, this is an ether group. And then these OHs, these are alcohol groups. So remdesivir was originally developed for the Ebola virus, and this inhibits RNA replication. So we'll look at this some more in understanding what RNA does in the body in chapter 13. This is another treatment. Chloroquine was originally used to treat malaria, but they found that it was useful in treating some of the symptoms, the early symptoms of COVID. This has a complicated structure, but again, let's find the functional groups. So what's important here are the nitrogens, 1, 2, 3, and so those are all amine groups. There's also chlorine, hence the name chloroquine, and then I can see this is a couple of benzene rings here. Dexamethasone is also used for treatment, and there are a lot of functional groups here. So this is a carbon double bond oxygen, that's a ketone group. Here's another ketone group. And then the OH, there's 1, 2, 3 of these, those are alcohol groups. And all of those functional groups are attached to what you might recognize is this basic 4-carbon ring that is present in steroids. Remdesivir, chloroquine, and dexamethasone have been found useful for early COVID treatments, and another for later COVID treatments are these anti-interleukin-6, anti-IL-6 drugs that block the immune response. Each individual that contracts COVID has a different response, and that's mostly due to their own immune system. So some people's immune system takes over and does overkill for trying to fight the virus. That's called a cytokine storm. And so that cytokine storm, which is your own immune response, actually leads to multiple organ failure. Trying to kill off the virus actually kills off a lot of your own organs. And so these types of drugs are antibodies against the IL-6 and block the immune response and preventing multiple organ failure. Antibodies are important in a convalescent plasma treatment that's being used. So this takes the blood from someone who's recovered from COVID and takes the antibodies from their blood and inserts them into someone that is suffering from COVID, allowing them to fight the virus. These are just the current treatments and medications for when you have the virus. Well, we'll get to vaccines next for preventing the virus.